Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn over the podcast to the students from the St. Louis College of Pharmacy at the University of Health Science and Pharmacy in St. Louis with their podcast titled Dose of Knowledge. We give credit to Professors Stephanie Lucas and Terry Walholick for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of the hosts and our guests and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis. Now let's hand the microphone over to our students.
Welcome to Breaking Cost Barriers. We are students from the St. Louis College of Pharmacy, and today we're talking about something that impacts nearly every American at some point, the cost of prescription drugs. Hi, I'm Jasmina, a P2 student here at St. Louis College of Pharmacy. I currently work at Mercy Lobby Outpatient Pharmacy and have been for the last 5 years.
Hi, I'm Maurice. I'm a second-year pharmacy student with diverse experience in retail, inpatient, and outpatient, and mail-order settings. I've been in pharmacy for 5 years also.
Hi, I'm Ty. I'm also a P2 student here at St. Louis College of Pharmacy, and I have a little bit of experience working community pharmacy at a CVS.
Hi, my name is Will. I'm also a P2 student at Stillcop. I have 3 years of community pharmacy experience and 6 months of hospital pharmacy experience.
Hi, I'm Ria. I'm also a second-year pharmacy student at St. Louis College of Pharmacy, and I have experience working at CVS and in independent pharmacy. I'll never forget when this older man came into the pharmacy and he saw the total on his prescription, $400. He just stood there silent and he said, "I guess I'll just have to wait until next month."
And sadly, that's not rare. It's a story every pharmacist sees. People walking away from the meds they truly need.
According to polling by the Kaiser Family Foundation, 1 in 4 adults taking prescription drugs reported difficulty affording their medication. And for those managing chronic conditions like diabetes, heart disease, or asthma, that cost burden can last a lifetime.
Today, we are going to talk about why medication prices are so high, what resources there are for patients who are struggling, and we're going to speak with Sanaya Zavari, a clinical pharmacist who works at Mercy Hospital in St. Louis, about her extensive experience helping patients who cannot afford their prescription.
Thanks for joining us today, Sanaya. Before we dive into ways you help patients, can you start by telling us how you became a pharmacist and what led you to Mercy?
Hi, yes. I've been a retail pharmacist for over 19 years. I became a retail pharmacist because I enjoy helping patients. At my previous employment, I started to feel unfulfilled. I felt like a robot in that I could not truly help patients. If patients had a financial need, I did not have any resources to help them. I knew that I wanted a change, but I wanted to make sure that my next employer shared the same vision and values. When I saw an open retail manager position at Mercy, I knew this would be the perfect fit for me. At Mercy, we believe in dignity and justice. We show compassion and care for everyone, regardless of economic status. We believe in service and putting the needs of others first.
I love that. You can really hear how much you care about your patients. It's refreshing to hear that perspective. It's not just about filling prescriptions, it's about serving people.
Before discussing solutions for high prescription costs, it's helpful to consider why prices are so high in the first place. This is a complex issue with valid points on both sides, and understanding the reasons can clarify the whole conversation.
Yeah, how are medication prices determined? Most countries negotiate prices with drug companies and telling them what they'll pay per pill, which is final. In the U.S., companies set their own prices without caps. Developing a new drug is costly and risky, taking 10 to 15 years and costing $1 to $2 billion. Many drugs fail late in trials, so high prices help recover costs and fund research. However, critics say prices are often higher than needed, especially since much early research is taxpayer funded. Companies spend heavily on market and profits, making U.S. patients pay more. Balancing innovation and affordability remains complex, and that's just part one.
Also, patents are a significant reason why drug prices remain high for extended periods. While they are meant to protect innovation, they often limit competition. During a patent, no one else can produce a generic version of the drug at a lower price until the patent expires. The intention is to compensate companies for their investment, effort, and risk in developing new drugs, but this often results in patients paying in the higher brand name prices for years. Additionally, as you mentioned, companies sometimes make minor modifications such as changing the dosage, changing the coating on the drug, or delivery method to extend their patent protection. This practice, which is known as evergreening, is legal but controversial because it can delay the arrival of cheaper generics on the market.
It's legal, but it keeps prices up. Then you've got these middle layers, PBMs, or pharmacy benefit managers. They're supposed to get you discounts by negotiating with drug manufacturers and insurance companies, but honestly, it's a black box. Sometimes they'll prefer a higher priced drug because it earns them a bigger rebate. So you end up with a system where everyone is making money off the process except the patient, who's paying more. If you're curious to understand how PBMs work behind the scenes, we really recommend listening to the PBM podcast. It breaks down the role that they play in drug pricing that's easy to follow and it's eye-opening.
Exactly. And what makes it more complicated is that every insurance plan has its own formulary, basically a list of what it covers. So one person might pay $10 for a drug while someone else pays $200 for the same thing because of how their plan is set up.
It can be confusing. It's a web of manufacturers, insurance, middlemen, and patents. But the good news is, even if we can't fix all that today, there are things you can do right now if you can't afford your medication.
So yeah, we've talked about why prices are so high, but let's shift gears to something more helpful. What you can actually do if you ever walk up to the pharmacy counter and the price is out of budget. There are some real programs and strategies that make prescriptions more affordable.
Exactly. The first thing is to talk to your pharmacist. I know that sounds simple, but pharmacists can check for generic versions that are way cheaper, therapeutic alternatives your physician can switch you to, or even cash prices or coupon options that might beat your insurance costs. Sometimes just asking, "This is out of budget for me, what are my options?" opens a whole conversation that saves you money the right way.
The next option is a 340B drug pricing program. It's a federal program that allows certain hospitals and clinics like nonprofit hospitals, county health departments, and community health centers to buy medications at deep discounts. They can then pass those savings on to patients. So if you're ever getting care at a big nonprofit hospital or a clinic that serves low-income patients, ask, "Are you a 340B site?" If they are, you might qualify for discounted meds without realizing it.
And if you don't have insurance or a regular doctor, federally qualified health centers, or FQHCs, are another great place to start. They're community clinics that treat everyone, no matter your income or insurance status, and most have on-site pharmacies that offer meds at a sliding scale. You can literally Google FQHC near me and find one close by.
Then there are patient assistant programs, which a lot of people don't know about. These are programs run by pharmaceutical companies to help people who can't afford their medications, especially brand name medications. Websites like needymeds.org and rxassist.org list thousands of programs like that. You should look up your medication name and they'll tell you which company to apply and what forms you need. It takes a little effort, but people save hundreds, sometimes thousands through these.
Okay, finally, there are coupon cards and discount tools. Websites and apps like GoodRx, SingleCare, or Mark Cuban's Cost Plus Drugs compare pharmacy prices and offer instant coupons. Sometimes paying cash with a coupon can be cheaper than using your insurance copay, so it's wise to check both options each time. However, it's important to remember that GoodRx isn't flawless. While it can help save money, discounts often apply only at certain pharmacies and can change frequently. Additionally, using a coupon instead of insurance usually doesn't count towards your deductible or your out-of-pocket maximum, and your prescription data might be shared with third parties for marketing. While these tools are useful for quick savings, it's best to be aware of these considerations. How do manufacturer copay cards work at your pharmacy, Sanea?
Manufacturer copay cards is a savings program offered by pharmaceutical companies to reduce out-of-pocket costs for brand name medications. These cards offset the price of medications. To use a copay card, you need to meet certain eligibility requirements, and there may be limits on how much you can save in a month or year. You can find these cards directly from the manufacturer's website or ask your pharmacist. Most copay cards restrict patients with government insurance, Medicare, Medicaid. Also, there are copay cards offered by manufacturers for patients with no insurance. For example, several insulin manufacturers have copay cards available to bring down the cost of insulin to $35 for non-insured patients.
That's actually really helpful. I think a lot of people assume those cards are a scam or hard to qualify for, but it sounds like it's worth checking every time.
A lot of patients often ask about GoodRx or discount coupons. Does Mercy accept those?
Mercy does not accept GoodRx coupons. However, we offer our own Mercy Pharmacy discount, and this can be used at any Mercy Pharmacy location.
So even if GoodRx isn't an option, Mercy's card gives patients another path to lower prices. It's important to know that many pharmacies do accept discount cards like GoodRx, especially for patients who are uninsured or need a lower cost alternative.
So yeah, the system is complicated, but you're not powerless. There are people and programs out there designed to help.
Sanaya, let's break down some of the resources hospitals offer for patients who are struggling to afford their medications. What kind of programs does Mercy have in place to help?
Mercy Neighborhood Ministries provides medication assistance for uninsured patients who lack resources to purchase necessary prescriptions upon discharge. To qualify, patients must be an established Mercy patient and be uninsured. The assistance can be used twice within 6 months and is reserved for non-controlled prescriptions.
That's such an important bridge. The gap between the hospital discharge and getting back on insurance is where many fall through the cracks.
There's also an excellent national program called the Dispensary of Hope, which partners with pharmacies across the U.S. to provide essential medications to patients in need. It's designed to support communities everywhere, not just locally, by ensuring the cost isn't a barrier to accessing care. Sanaya, can you explain how patients qualify?
The Dispensary of Hope is for uninsured members of our community who lack resources to purchase needed prescription medications. To qualify, the following guidelines must be met. Patients have no insurance or have a commercial plan with no prescription coverage. Patients with Medicaid, Medicare, Indian Health Services, or VA coverage are not eligible. Patients' current estimated annual household income must be at or below 300% of the most current federal poverty guidelines. You can find a pharmacy that participates in Dispensary of Hope by going to dispensaryofhope.org and searching for a dispensing site near you. Mercy Pharmacy locations that participate include St. Louis Dallas, Kennerly South, Washington, Jefferson, and Lincoln. If you are in need of help and fit the criteria, all you have to do is stop by the pharmacy and ask for an application. It is easy to fill out and the pharmacist will check to see if you qualify. The Dispensary of Hope receives medications that are donated from manufacturers. Medication formularies are updated quarterly and consist of primary care medications to treat chronic diseases including infectious disease, cardiovascular, mental health, diabetes, gastrointestinal, and allergies. If we do not have a medication on the formulary that a patient needs, there may be an alternative we can ask their doctor to switch them to.
That's incredible, and I love that it's not just a Mercy thing. Dispensary of Hope partners with hospitals and clinics across the country, so if anyone listening can visit dispensaryofhope.org to check whether their local pharmacy participates.
Let's talk about insurance, Sanaya. How does your team handle situations when a medication isn't covered by a patient's plan?
Our pharmacy filling system, Willow, allows us to get real-time paid claims or rejections. The rejections provide us insight on how to proceed. Sometimes prescriptions require a prior authorization. A prior authorization is where a healthcare provider must obtain approval for the medication to be covered. We also see rejections where the drug is not covered on formulary. In those circumstances, we reach out to the provider and offer covered alternatives. There are also situations on where it is covered but at a higher tier. Providers may feel comfortable switching the medication to a lower tier. Pharmacists are not allowed to change the medication, but we offer alternatives to the provider to make the best recommendation.
So even if the original medication isn't covered, the provider might still be able to switch it to something in the same class that it is and make it affordable again.
Wow, Sanaya, you shared a lot of resources, but I know you've also seen the personal side of this. Can you tell us about a time when you were able to help a patient?
Just the other day, I helped a patient by enrolling her in the Dispensary of Hope. They had been admitted for a diabetic complication and due to the circumstances were not able to afford insulin. We offer Humalog and Basaglar insulin on our Dispensary of Hope formulary. The patient was able to go home with insulin for no charge and was very happy and appreciative about the program.
That's a beautiful story. I can only imagine how relieved that patient must have felt to finally go home with their insulin and not worry about the cost. And it's amazing how one conversation and one program can make such a difference in someone's life. Thanks for coming in today and speaking on your experience at Mercy and providing informative resources for patients who need the help.
What Tanea shared really reminds us that help is out there. You just must know where to look and not be afraid to ask.
Exactly. Whether it's a hospital-based program like Dispensary of Hope, a manufacturer copay card, or simply talking to your pharmacist about alternatives, there are real ways to make your prescriptions more affordable.
And if you're struggling right now, here are a few places to start. GoodRx, Single Care, or Mark Cuban's Cost Plus Drugs compare prices and find discounts. NeedyMeds.org and RxAssist.org for free or low-cost patient assistance programs. Federally qualified health centers, or FQHCs, offer care and medications even if you don't have insurance. And 340B pharmacies sell certain medications at significantly lower prices.
No one should ever choose between their health and their bills. If you're having trouble affording your medication, start the conversation. Your pharmacist can help you connect with programs and resources that fit your situation.
Thank you to Tanea Zavary and the team at Mercy Pharmacy for sharing their work and compassion. And thank you for listening to our podcast.
A big thank you, students, for hosting the Dose of Knowledge podcast as part of the Pharmacy Frontiers. And thank you to our listeners for joining us today. Please share this episode with your friends and seek out other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcast channel.